Science. Hey, Vsauce Jackson here. My wife may have left me, but at least I still have this YouTube channel. Anyway, you like blood, don't you? Don't lie. I know you do. Well, what if I told you that blood could just not clot? Sounds weird, huh? And it is. The disorder is known as hemophilia. In essence, it causes an inability to clot blood, both internally and externally. This can be fatal under the right conditions, as clotting is important for repairing wounds in the human body. There are 3 different types of hemophilia, types A, B, and C. Between you and me, there's also mild and severe hemophilia, which is also important to consider. The type we will talk about here is type A. It's the most common type, with around 85% of hemophiliacs having it. Among the type A patients, around 65% of them have the severe variation, making it one of the most common forms of hemophilia.
Good morning, class. Alright, settle down. I know you're all very excited to learn today. Today we'll be learning about some of the many symptoms of hemophilia type A. Now, type A hemophilia can have many signs and symptoms, but here are a few important ones. Excessive bleeding, nosebleed without a known cause, pain, swelling, or tightness in joints, and severe bleeding in the brain. The bleeding in the brain can cause problems such as seizures and paralysis. Hemophilia is theorized to be inherited through an X-linked recessive pattern. Put simply, the disorder can be passed down from parent to child through mutations in the X chromosome. Men are much more likely to cause this mutation as they have a single X chromosome, and the recessive mutation of that chromosome will cause a condition in their child. Women are less likely to carry the disorder due to their possession of 2 X chromosomes, but if both are manipulated, then the child will end up with hemophilia. Also, like most disorders, hemophilia can occur due to a rogue mutation. This is less likely than inheritance, though. You stank.
Hello, not so alive audience. Today we happen to snag an exclusive interview with the one and only John Conrad Otto, founder of Hemophilia. You say that like it's a good thing. Also, I'm kinda dead. Oh, potato. Anyway, I'd like to ask, what year did you discover hemophilia? I believe it was 1803 that I published an article that recognized the condition you know as hemophilia in males. One of my proudest works, if I do say so myself. Interesting. Tell me, when did you discover the different types of hemophilia that existed? That wasn't actually my doing. That credit goes to an Argentinian physician by the name of Alfredo Pavlovsky, who found the A and B types of the disorder. Well, when did we first recognize its existence? I believe some of the first recorded incidents of the condition stem from the Talmud. I see. Many of these instances were Jewish boys bleeding out after getting circumcised. Whoa. That looks like all the time we have for today. I'll catch you right back after the ad break, where we have an exclusive interview with the one and only...
Are you at your level struggling with hemophilia? Well, you need to try Hemlibra, the only medicine in the market that replaces the function of the F8 protein. Or maybe you could try episodic and prophylactic care to stop and prevent bleeding respectively. Or you could even just try injections of clotting factor concentrates. Who knows? Who cares? Just take our stuff. We want your money. Side effects may include bleeding, death, multiple types of cancer, or even heart failure. Please proceed with caution if a faculty doctor with no medical license attempts these procedures on you. Please don't take Hemlibra with any other medications. You will combust on the spot. Please don't take this seriously. It's only a joke. Yeah, bye. This size guy. Hey, welcome to Night Bye Laboratories. I bet you want to learn about blood. It's such an interesting concept. Why wouldn't you? Now take this ketchup bottle of science. Let's say I'm just some average Joe. I would bleed like this. See? Eventually just stop on my own. But if I had hemophilia, I would bleed like this. See? I just keep bleeding and bleeding. You might be saying, oh, no, bye, that sounds terrible. Could I be affected by it? The answer is yes. Anyone can be born with hemophilia. Nothing can save you. Your demise is inevitable, except... Yeah, bye, the science guy.
Hello, welcome back to the Pending Podcast. Today we've snagged an interview with some random science nerd that I found off the street. Hello, I'm the science nerd. Wait, now tell me, Where is the gene that causes hemophilia, and what is it? That seems like a weird and arbitrary question to ask me. Do you have anything better? Answer the question. It's F8 gene located in chromosome X at position Q28. It makes the F8 protein, which helps in blood clotting. Well, what would the issue be if the gene was mutated? Well, it may cause a lack of ability to clot, which can lead to different symptoms of varying severity. Very good, very good. If you enjoyed this video, please make sure to like and subscribe so that I get a feeling of social validation in life. Can I leave now? No.
Alright class, let me show you a model of what I've been explaining. Now this model here displays the clotting process when a blood vessel is broken. As you can see, many different genetic materials come together to patch the wound. If this person were to have hemophilia, those materials would not be produced and the wound would not clot. But what kind of mutation causes this disorder? Scientists believe that large amounts of deletion from the F8 gene can cause hemophilia to occur. Alright class, you're dismissed. Why am I doing this job? I could be doing so many more productive things with my life. I could be having a much better, higher paying job, but instead I'm teaching children science. If only I decided to take up a better profession where I wouldn't be losing out on thousands of dollars that I could be attaining through any other field of work. Oh, this was a mistake.
This sucks!